The government has no goodwill and has no intention.
Public health facilities countrywide will continue to grapple with the absence of clinical officers as well as nurses after a sixth session aimed at resolving the matter failed to take place.
We have been here as we were called in the morning to attend a meeting where the CS Health and the chair of COG, Wycliffe Oparanya, were to be around, and where the government was to give us their commitment and offer so that we could consider going back to work. We came and waited from 10 o'clock to now, and none of them appeared in any meeting.
Union leaders continue to decry the national government's ignorance on their grievances, ironically encouraging Health CS Mutahi Kagwe's sentiments, threatening to fire them for failing to provide healthcare services.
We are willing to be fired and be left alive to seek jobs in the next year.
We saw the CS yesterday saying that they are going to sack us and employ new health workers. We are wondering if we have some health workers who are immune to COVID, who can actually go and work in an environment that is unsafe.
The judiciary has now been called upon to not issue court rulings that will further oppress the health workers and instead focus on the safety of their workplaces, as well as the government's intention to comply with their wishes.
We are appealing to the judiciary not to accept the advances of the government who wants to twist us using court orders so that we can go back and commit suicide in unsafe environments.
They should not be used by the employers to postpone the problems of health workers, to postpone the suffering of Kenyans.
The clinicians' continued strike threatens to heighten destabilization of the country's already crippled health sector, with doctors expected to start their strike come Monday.
How do we get more additional healthcare workers?
The Kenya Medical Practitioners, Pharmacists and Dentists Union KMPDU says the decision was reached after negotiations for better work conditions broke down. Talks have been going on for close to 8 months now, revolving around provision of medical covers, as well as the provision of protective gear to protect medics against COVID-19.
We are being treated to a rhetoric at a time when our people are suffering, our people are dying, including ourselves.
Ben Kirera, K24, Punchline.